The Global Fund has saved lives and transformed communities for 20 years. But COVID-19 is devastating communities and health systems around the world. And for the first time since the Global Fund's founding, we lost ground in the fight against HIV, TB, and malaria. Our stories are the reasons why, in a COVID world, we must take bold and decisive action to fully fund the Global Fund.
I spent almost like 2 years in depression and thinking that what I'm going to do and where my life is heading. But after 2 years, I remember I sat with myself and I scolded myself. I was like, Gautam, you are not dying. Nothing is happening, so it's better you start working. So then that day I decided that now I should become a voice of people who are living with HIV and the LGBT community, and that's how my journey started. If not Global Fund, then who is going to work? And if it is not you, who is going to fund? So this is my question to everybody, like if it is not you, who is going to do?
When HIV and TB was combined together, mentally I was affected. I was isolated, I was discriminated, I was stigmatized. I would say I was dehumanized because that moment for me, living wasn't an option. Despite everything that happened, today everything, my story is quite different. I've also seen a lot of transformation because beyond just Global Fund being part of saving me through antiretroviral therapy, ensuring that I have ARVs to take and be alive, Global Fund have given me an opportunity to be on that global decision platform where I can lend my voice to speak for many youth and many young people.
We want to be understood that that is the hardest thing of our life, seeking the treatment and then have to continue the treatment. Me as a woman, as a mother, and also a person that didn't want this happen for me, but we cannot choose our destiny. I'm not be alive without the investment and the support from the Global Fund. As the leading TB donor in my country, and I feel that moment the Global Fund will save my life.
So the main message I want people to take away from this is that malaria is real. And the impact it's having on lives is real. The people that are dying, that is real. Mothers in my country actually calculate the odds of their children surviving. So the impact that we are making when we are saving those lives is real. If it wasn't for the Global Fund, there's a very, very good chance that I would not be here today. So I would not be an entomologist fighting malaria today. And that is just one life. Think of the millions that have been saved and what they are doing today. So the problem we are battling, it is a real problem. And we are making a big difference when we do. The money that the Global Fund is putting into malaria control is making a difference. It is important. It's worth it. Because you cannot put a price on life. And those lives are the future of the world.
In 2015, my daughter was 7. It was a little girl, and she doesn't know what has happened with her mother. It was hardly for us because with your diagnosis comes fear, because you didn't know nothing about your disease. but you see how people reaction around you. We know how we can diagnose tuberculosis. We know how we can treatment tuberculosis, but we doesn't know how we can fight stigma around tuberculosis. Tuberculosis never been priority questions for governments, for countries, and more years, every year, Global Fund help and financing for countries for their measures with fights tuberculosis, HIV and malaria.
On the 1st of July 2014, I fell very ill and I was taken to the hospital. And the doctors at the hospital at first glance declared that I should be tested for HIV, and the test came out positive. Of course, just like everybody else, I went through the phase of struggling with accepting myself. So that is what really inspired me to be an advocate, to change people's notions, to change people's attitudes, and most importantly, to give a safe environment for people living with HIV. My main message is always simple: fully fund the Global Fund, because some of us are here because the Global Fund is in existence. We are here because someone somewhere made that contribution, and someone somewhere ensured that the quality of life of people living with HIV is improved.
We are here because of the Global Fund. We are living proof of the Global Fund's impact. There is so much more to do, which is why we ask you to take action and fully fund the Global Fund.